Welcome back to Tampa Bay's Morning Blend. So often during this time of pandemic with COVID-19, we've been talking about special groups. One group in particular, the seniors out there. How do we keep seniors safe? How do we keep them healthy? And one focus always of senior health is MyCare Medical Group. And I'm so glad to welcome back to our show, James Dubray and Dr. Shaw. Thank you both so much. I know how busy you are right now, so I really do appreciate your time.
No problem.
Thank you. Good morning.
And let's talk. We were chatting before we got started. You say the MyCare Medical has been open. You had to change the way you were practicing and seeing patients there for a while. Now let's talk about the impact of COVID-19. Seniors especially have to be really careful. Dr. Shaw, I want to start with you. And what are you doing with MyCare Medical to make sure that seniors are staying healthy, and how important is it during this time for them to remain healthy and stay up to date on their medical appointments?
Yeah, I think, most of my patients and the seniors have maintained good health because they've been in constant communication with their primary care physicians, may it be via phone calls or virtual visits, or even seeing them in person. I truly believe that maintaining good health requires tailored visits, appropriate consultation, and proper educations to all of my patients.
Well, along the lines of those education and just having those conversations, I'm assuming easing fears has to be a part of some of the communication that you're having with your patients. Because again, seniors, you're hearing stay home, don't venture out. How are you able to make those visits safe for them?
People are afraid. Definitely, people are very afraid. But as a primary care physician, I would like to first of all say, do not ignore your symptoms. Do not ignore any of your symptoms. So, saying that, no matter how small the problem you think it is, always stay in constant communication with your primary care physician. No matter, you call them, ask them questions, talk to them about any concerns you have, no matter how small you think the problem is. In our offices, actually, we have proper protocol in place so the patients feel comfortable coming in, they feel safe coming in. As a matter of fact, if patients call us, we talk to them on the phone, we do virtual visits via video conferencing, and we can even pick them up.
I feel like the information about COVID-19 seems to always be changing as we continue to learn more about this. And from your standpoint, are there different symptoms that maybe seniors need to be more in touch with or in tune with to give you a call earlier than, say, an average patient?
So usually the typical symptoms of COVID-19 is fever, cough, and shortness of breath. But as you mentioned, that there are some atypical symptoms like GI symptoms of nausea, vomiting, diarrhea. But all in all, we look for anything that is out of the ordinary, anything. So again, it's that important to always be in constant communication with your primary care physician at all times.
Well, Dr. Shaw, that's a great segue actually to bring James back in, talking about staying in touch with your primary care. James, I want to reach out to you and talk about patients who maybe are thinking about switching to a different primary care. Are you still taking new patients right now?
Oh, absolutely. Absolutely. We do. Our mission is to make sure we take care of seniors' health, period. Whether you're a patient of ours or not, we want to make sure you have access to care. And so if you reach out to us and give us a call, we'll make sure we remove every obstacle in your way to stop you from being able to see us. We want you to talk to a primary care physician as soon as you can and you need to. And we remove all those barriers to make sure that you can come on board with us. And we are seeing new patients actively today.
And you're still able to offer the telemedicine and the different ways to get in touch with you, correct?
Absolutely. Access to care means all access. So whether you talk to us over the phone, whether you do a video chat or you come and see us in person. In fact, even if we have to send a car to get you, we want to make sure you have access to care, and we have all those mediums and tools available to help you.
Well, as we're starting to wrap up here, I want to talk about during this time, the stay at home, safer at home. How have seniors been able to do? What have you been seeing on your side of things dealing with a practice? The focus is on seniors.
Yeah. So what the seniors have really responded very well to our outreach. One of the things that we've been doing on an ongoing basis is really reinforcing Dr. Shaw's message, and that is Don't avoid any symptomology, any concerns that you may have, because a day delay turns into a week turns into a month, and no one knows when COVID is going to go away. So we encourage you to reach out and talk to a primary care physician now, regardless of the smallness of the symptomology that you may think it is. And we will do everything we can to make that happen. MyCare Medical is quality care that follows you everywhere. And living up to that promise means having access to care wherever you may be.
Quality care that follows you everywhere, no matter what time, right? Gentlemen, thank you both for so much for joining us. Dr. Shaw, thank you too for your work in the community during this time. Of course, mycaremedicalgroup.com. That's how you can get more information along with the phone number right there. To the both of you, be well, stay healthy, and thanks again for your time.
Thank you.
And we hope you stay right there because the show will continue on the other side of the break.